Adam Schayek here with Real-Time Neurology. Today, I'm joined by Matthew Sutliff, a doctor in physical therapy and the clinical team leader at the Mellon Clinic for Multiple Sclerosis Treatment and Research at the Cleveland Clinic in Ohio. Matthew, thank you for joining me today, and great presentation. So today, Matthew's presentation was about the use of technology and outcome measures in physical therapy. Matthew, could you tell us a little bit, what is an outcome measure in physical therapy?
So we have to measure how our patients are doing. So how do they function walking? How do they function with their balance? How is their balance when they're walking versus in walking through a grocery store aisle and looking for food versus whether they're just standing at the counter? So we have systematic ways to try and measure that and then kind of put a score to it, so to speak, so that then when we do a physical therapy intervention or any other form of intervention, we can measure whether or not that's helpful or not, and whether or not our patients are getting better and more active.
And Matthew's actually working on some cutting-edge technology of recording these scores that we were talking about and possibly doing stuff in the future. For me, in practice, I hate writing down my scores and then going back to writing it in the system. So can you tell us, what is it that you're going to use that data for in the future for that specific patient or possibly for all of multiple sclerosis?
So at Cleveland Clinic, our engineers have developed something called the Multiple Sclerosis Performance Test, which looks at things like visual acuity. It looks at hand function, walking speed. It looks like at cognition, and it helps to measure that, and it's done through an iPad-based technology. So when a patient comes in, they can complete those tests, and what it does is it gives us better data, and then it allows them actually more time face-to-face with their physician to really be able to sit down and discuss that, so that they can really try and work on solutions to try and help out with whatever problems they may have. Now, on the physical therapy side, we've now started to develop, actually I shouldn't say we have software developers and a really talented team of people that are working on developing this for our physical therapy measures. So things like your ability to walk down the hall and how quickly you're able to do that. Can you walk at a speed that's sufficient to get, say, through a crosswalk and get across the road? Or is that too slow? And maybe what can we do to try and help with that? We look at measures of lower extremity strength, so leg strength, so your ability to get up and down from a chair 5 times, and how quickly can you do that? That's a nice measure, just a basic measure of leg strength. And so it's been a tool that we've implemented in clinical practice, and it's helping us really measure and quantify how our patients are doing, both before physical therapy, while they're doing their exercises, and then at the end of physical therapy if we have a point where we kind of slow down on treatment. So
That sounds like a great use of technology to kind of track that progression and kind of see how everything's going. So that's great. And the last question is kind of, a lot of times people hear technology and taking these tests that we already know how to do and trying to put it into something technology based, making sure it connects, making sure you set it up properly. Wouldn't it take longer to use this kind of tech to take these measurements, and might people like use them less, or what was your experience using this tech? Was it faster?
I think when it first came out and we first rolled out this technology, a lot of us tried to determine, well, is this really going to be better?
Right.
So is it easier just to use a stopwatch and capture some of these outcomes? But we've actually found that it's quicker to capture the data this way, and it's much more accurate, and it gives us additional data. So for example, when we do a test called the timed up and go, the old way, we would just time the amount of time it takes to stand up, walk 3 meters, turn around, walk back, and sit in a chair. We now can look at how someone does when they stand up, walk 3 meters. We can time how long it takes them to make the turn, because in some cases it's really hard for people to make a safe turn. Maybe they try and rush through it and then they lose their balance in that turn. So we can capture that. And now that helps us direct, like, we really need to work on those turns, and we need to do that in a safe way to try and prevent a fall down the road. And so not only is it faster, but it's better data.
And that sounds like some great data for us as clinicians to then drive our care as to what part of the function that we're going to work on specifically. Matthew, I want to thank you for your talk. Thank you for joining us today, and thank you at home for watching Real Time Neurology.